Also, could you talk to me a little bit about, we know that federally heroin exists, is not legal. We know marijuana is not legal. It is legal in Connecticut, I understand that. But is this ultimately legalizing heroin because you are able to use it in these places through you, Madam Chair?
Thank you very much. And Representative, I'd just like to go back, if I may, to the CON conversation for just a moment. One of the aspects of our CON process is looking at access, quality, and cost of care. We know that we don't have access to this in the state. We know from a cost standpoint, in terms of impacts to the system, we are not using state or federal dollars. And so in those respects, I know that doesn't fully answer your question, but I just did want to remark on that. But in terms of your question, no, this does not make heroin legal. What this does is allow people who are using illegal substances to do so in a safe, supervised environment so that they can survive, and in the hopes that we can help provide services and help them to move on to treatment. But no, it does not make that substance use legal.
So thank you for your answer. It doesn't make it legal, but we're allowing people to use illegal drugs in these places.
What I would say is we are allowing people to assure their survival so that they can recover. That is what we're doing.
Thank you. I appreciate your answer. I would disagree, but I appreciate it. And I know someone very dear to me that was on drugs, and if this would have been available for them, they would have probably never gotten off of drugs. And so, as my good ranking member spoke about trying to get people off of drugs, I remember when in this public hearing I specifically asked the question to somebody if they try to help people get off drugs. And the answer was, no, we want them to be happy. And while I understand we want people to be safe, I want people to be happy, but I want people to be able to get back to their families, their parents, their children, their friends. And what bothers me about this is that this doesn't do it. This does not help people get off of drugs. It may give them a safe place instead of going behind a dumpster, which I know people that have gone behind dumpsters and been found alive and survived, but I know it doesn't happen to all. So I really struggle with this, and I guess what I struggle with mostly is hearing people tell me that I don't have compassion because I don't vote for this bill. That is so insulting and quite honestly infuriating to me, because I want people off drugs. I want people to have a happy and healthy life. And to say because someone doesn't support this or meet them where they are, I have more compassion probably than a lot of people and have empathy, and that is infuriating to me. Thank you, Madam Chair.
Thank you very much, Representative.